Concerning heart wellness, vegetables represent far more than dietary supplements. They function as therapeutic nutritional interventions for vascular health. Strategic vegetable selection can diminish cholesterol levels, combat inflammation, optimize circulation, regulate blood pressure, and preserve the fragile endothelial tissue lining cardiovascular structures. However, vegetables don't deliver uniform benefits. Certain varieties actively facilitate healing and repair of cardiovascular damage, while others yield minimal advantages without proper preparation and consumption. For cardiac patients, informed vegetable choices combined with appropriate preparation methods can decelerate disease progression, enhance circulation, and minimize subsequent complication risks. This educational resource examines 10 vegetables consistently endorsed by cardiovascular specialists for promoting arterial strength, optimal cholesterol balance, and superior cardiac function, accompanied by scientific explanations of their physiological mechanisms. These accessible, budget-friendly foods facilitate authentic cardiovascular healing through consistent dietary incorporation. This material serves informational purposes exclusively and does not constitute professional medical guidance. 1. Spinach, promoting arterial dilation through nitric oxide. Among vegetables routinely recommended by cardiovascular specialists, spinach distinguishes itself through its direct influence on vascular relaxation and circulatory enhancement. Arterial rigidity and constriction constitute primary complications in cardiac disease. Spinach addresses these concerns by promoting nitric oxide synthesis, facilitating vessel expansion, pressure reduction, and enhanced blood flow. Superior circulation diminishes cardiac workload and reduces complication risks, including elevated blood pressure and chest pain. Nutritionally, spinach delivers abundant natural nitrates, magnesium, potassium, folate, and antioxidant compounds. Dietary nitrates undergo biochemical conversion to nitric oxide, prompting vessel wall relaxation. Magnesium modulates vascular tone and cardiac rhythm, while potassium counterbalances sodium to maintain optimal blood pressure. Folate reduces homocysteine levels, a biochemical marker associated with arterial deterioration and plaque accumulation. Medical research demonstrates strong correlations between leafy green consumption and reduced blood pressure, enhanced endothelial performance, and fewer cardiovascular incidents. Clinical investigations indicate that consistent nitrate-rich vegetable intake improves arterial elasticity and reduces systolic pressure measurements within several weeks, a frequently overlooked benefit. Spinach continues facilitating nitric oxide synthesis for approximately 24 hours following consumption, delivering extended vascular protection. Practical implementation: consume 1 to 2 cups daily through gentle steaming to minimize oxalates. Incorporation into soups or egg preparations, or freshen salads dressed with olive oil and lemon juice. For individuals receiving anticoagulant therapy, maintain steady rather than eliminated consumption. Alternate with other leafy greens to prevent excessive oxalate accumulation. 2. Broccoli, multi-level vascular protection and cholesterol management. Broccoli emerges consistently in cardiovascular research as a cruciferous vegetable offering comprehensive arterial protection, cholesterol damage reduction, and sustained cardiac wellness support. Cardiac patients require foods extending beyond simple cholesterol number reduction. They need nutritional interventions preventing ongoing vascular damage. Broccoli diminishes inflammation, facilitates cholesterol elimination pathways, enhances endothelial performance, and reduces oxidative stress that transforms LDL into arterial plaque. Consistent consumption correlates with decelerated atherosclerosis progression and improved cardiovascular resilience. Biochemically, broccoli contains sulforaphane, a sulfur-based compound activating the body's inherent antioxidant and detoxification mechanisms. Sulforaphane reduces oxidative stress within arterial walls, preventing LDL cholesterol oxidation and adhesion. Broccoli's soluble fiber binds intestinal bile acids, compelling the liver to utilize circulating cholesterol for bile synthesis, naturally reducing LDL concentrations. Additionally, broccoli provides potassium, magnesium, folate, and vitamin C, collectively supporting pressure regulation, vessel relaxation, and nitric oxide availability. Published cardiovascular research demonstrates sulforaphane's protective effects on endothelial cells against inflammation and oxidative damage. Nutrition experts emphasize cruciferous vegetables like broccoli as essential for cardiac patients due to improved cholesterol metabolism and diminished vascular inflammation. A lesser recognized fact. Gently steamed broccoli delivers superior cardiovascular protection compared to raw or overcooked preparations, as steaming preserves sulforaphane activity while enhancing nutrient absorption. Practical implementation. For cardiac patients, broccoli proves most effective through consistent consumption and gentle preparation. Target half to 1 cup daily, cooked or lightly steamed for 3 to 4 minutes to preserve sulforaphane. Combine with olive oil or avocado to enhance fat-soluble nutrient absorption. Incorporate into soups, stir-fries, grain bowls, or alongside fish or legumes. For those sensitive to cruciferous vegetables, begin with modest portions and increase gradually. Cooking reduces gas-producing compounds while maintaining cardiac benefits. 3. Beets. Rapid circulatory enhancement through nitric oxide. Among vegetables capable of swiftly and naturally improving cardiac blood flow, beets stand unrivaled. Their circulatory impact proves so substantial that cardiovascular specialists frequently characterize them as natural vascular relaxants. Cardiac patients commonly experience compromised circulation, arterial rigidity, and diminished oxygen delivery to cardiac tissue. These complications elevate blood pressure, strain heart muscle, and impede healing. Beets directly address this challenge by optimizing blood movement through arterial pathways. Enhanced circulation reduces cardiac pumping effort, delivers oxygen more efficiently to tissues, and decreases overall cardiovascular stress. Biochemically, beets rank among nature's most concentrated dietary nitrate sources. Following consumption, these nitrates convert into nitric oxide, a molecule inducing vessel relaxation and dilation. Nitric oxide improves endothelial function, reduces arterial stiffness, and enhances blood flow to cardiac and cerebral tissues. Beets additionally contain betalains, potent antioxidants reducing oxidative stress and inflammation within arterial walls, protecting against plaque-inducing damage. Medical institutions recognize nitric oxide as fundamental for vascular wellness. Clinical investigations published in cardiovascular journals demonstrate that beet consumption significantly lowers systolic blood pressure and improves endothelial function within days. Research additionally suggests enhanced exercise capacity in cardiac patients through improved oxygen delivery following beet intake, a remarkable finding. Beets can improve vascular flexibility within merely 2 to 3 hours post-consumption through rapid nitric oxide production. Practical implementation. Incorporate beets through multiple cardiac-friendly methods. Cooked beets, roasted or boiled, at 2 to 1 cup daily. Raw beets grated sparingly into salads. Beet juice, half cup diluted with water, preferably earlier in the day, or beet powder in small amounts mixed into smoothies. Pair beets with vitamin C-rich foods like lemon or peppers to stabilize nitric oxide. For individuals with kidney stone history or oxalate sensitivity, maintain moderate portions and rotate with alternative vegetables. 4. Tomatoes. Lycopene-mediated arterial protection. While often relegated to simple salad ingredients, tomatoes represent among the most powerful artery protective vegetables for daily cardiac patient consumption. Cardiovascular disease doesn't manifest through sudden arterial blockage. It develops progressively through inflammation, oxidative stress, and LDL cholesterol damage. Tomatoes address all three mechanisms. Their distinctive antioxidant composition prevents LDL oxidation, reduces arterial inflammation, and improves vessel flexibility. For individuals managing elevated blood pressure, high cholesterol, or early-stage cardiac disease, tomatoes provide daily defense against plaque advancement. Biochemically, tomatoes contain abundant lycopene, a powerful antioxidant accumulating in blood vessel walls. Lycopene neutralizes free radicals before they damage LDL cholesterol or irritate the endothelium. When LDL remains unoxidized, arterial wall adhesion likelihood drastically decreases. Tomatoes additionally supply potassium, facilitating vessel relaxation and counteracting sodium's pressure-elevating effects. Furthermore, tomato vitamin C supports nitric oxide stability, improving blood flow and reducing arterial rigidity. Notably, lycopene bioavailability increases when tomatoes undergo cooking, rendering tomato sauces, stews, and soups particularly cardiac-friendly. Research consistently links elevated lycopene intake with reduced cardiovascular risk. Published studies demonstrate that individuals with higher blood lycopene concentrations exhibit significantly lower arterial plaque rates and cardiac events. Meta-analyses confirm that tomato consumption improves endothelial function and reduces LDL oxidation, a frequently overlooked detail. Cooked tomatoes can deliver up to 4 times more absorbable lycopene than raw tomatoes, making tomato-based preparations especially powerful for cardiac repair. Practical implementation: target 1 to 2 tomato servings daily using varied raw and cooked forms. Fresh tomatoes in salads or sandwiches. Cooked tomato sauce with olive oil, tomato soup with herbs and vegetables, or cherry tomatoes lightly roasted with garlic. Always pair tomatoes with healthy fats like olive oil to optimize lycopene absorption. Select low-sodium or homemade tomato products to avoid excess salt. For acid reflux sufferers, cooked tomatoes typically prove gentler on digestion than raw. 5. Garlic. Natural vasodilation for blood pressure and cardiac protection. Garlic transcends its culinary role. It represents among the most potent natural vasodilators in cardiovascular nutrition, delivering direct effects on blood pressure, circulation, and arterial wellness. For cardiac patients, elevated blood pressure, arterial rigidity, and compromised circulation constitute major risk factors for heart attacks and strokes. Garlic addresses all 3 concerns, facilitating vessel relaxation, improving blood flow, reducing arterial stiffness, and lowering cardiac strain. Unlike pharmaceutical interventions operating through singular pathways, garlic supports cardiac health through multiple simultaneous mechanisms, establishing it as invaluable for sustained cardiovascular protection. Biochemically, crushing or chopping garlic releases allicin, a sulfur compound triggering nitric oxide and hydrogen sulfide production, 2 signaling molecules relaxing blood vessel smooth muscles. This arterial widening reduces blood pressure and enhances circulation. Garlic additionally diminishes oxidative stress within arterial walls, preventing endothelial damage to the thin inner lining, controlling blood flow and clot formation. Furthermore, garlic decreases platelet adhesiveness, reducing unwanted clot accumulation risk. Medical institutions recognize garlic as cardiac supportive. Clinical studies demonstrate that regular garlic intake can reduce systolic blood pressure by 5–10 millimeters of mercury, comparable to first-line lifestyle interventions. Research additionally shows garlic lowers LDL oxidation and inflammatory markers like C-reactive protein, both directly linked to atherosclerosis progression. A critical detail: whole garlic remains inactive until crushed. That's when allicin forms. Practical implementation: to obtain cardiac protective garlic benefits, crush or chop fresh garlic and allow 10 minutes resting before cooking to maximize allicin formation. Use 1 to 2 cloves daily within meals. Incorporate into vegetables, soups, lentils, beans, or whole grain preparations. Gentle cooking proves acceptable, but avoid prolonged high heat destroying allicin. For sensitive digestion, roasted garlic proves gentler while maintaining benefits. For individuals receiving anticoagulant therapy, large supplemental garlic doses warrant medical discussion, though culinary quantities remain generally safe. 6. Carrots. Fiber-rich arterial and cholesterol protection. Despite their modest appearance, carrots deliver exceptionally effective combinations for cardiac patients: cholesterol-lowering fiber, antioxidant protection, and gentle blood pressure support unified in one vegetable. For cardiac patients, controlling LDL cholesterol, reducing inflammation, and protecting blood vessels proves critical. Carrots support all 3 objectives, helping lower cholesterol absorption, protecting LDL from oxidation, and reducing arterial stress without irritating digestion or spiking blood sugar. Unlike numerous starchy vegetables, carrots provide steady energy while supporting vascular health, proving especially suitable for individuals managing hypertension, elevated cholesterol, or early-stage cardiac disease. Biochemically, carrots contain abundant soluble fiber, particularly pectin, binding intestinal bile acids. Since bile acids derive from cholesterol, the liver must extract LDL cholesterol from circulation for replacement, naturally lowering LDL concentrations over time. Carrots additionally provide beta-carotene, a powerful antioxidant converting to vitamin A. Beta-carotene neutralizes free radicals damaging arterial walls and oxidizing LDL cholesterol. By reducing oxidative stress, carrots maintain LDL particle stability, reducing plaque formation likelihood. Additionally, carrots supply potassium, supporting healthy blood pressure by counteracting sodium's vessel-constricting effects. Nutrition research consistently links carotenoid-rich vegetables like carrots with reduced cardiovascular risk. Published studies demonstrate that elevated beta-carotene intake associates with reduced arterial stiffness and improved endothelial function, a frequently unknown benefit. Carrots reduce LDL oxidation even when cholesterol measurements remain unchanged, meaning arterial protection occurs before laboratory values improve. Practical implementation: Carrots prove safe, versatile, and easily incorporated daily. Raw carrots provide excellent fiber and gentle blood sugar response. Lightly cooked carrots increase beta-carotene absorption. Steaming or roasting with olive oil enhances antioxidant uptake. Carrot soups or purees facilitate digestion for sensitive stomachs. Target half to 1 cup daily. Pair carrots with healthy fats like olive oil, nuts, or hummus to improve fat-soluble antioxidant absorption. Avoid sugary carrot juices, removing fiber and rapidly elevating blood sugar. 7. Brussels sprouts, cholesterol clearance and arterial protection. Brussels sprouts rank among the most underappreciated vegetables for cardiac patients, yet offer powerful protection against cholesterol accumulation, inflammation, and arterial damage. These compact cruciferous vegetables contain abundant soluble fiber, sulfur compounds, antioxidants, and vitamin K, all directly supporting cardiovascular wellness. From a cholesterol perspective, Brussels sprouts function through 2 critical mechanisms. First, their soluble fiber binds digestive tract bile acids. Since bile acids originate from cholesterol, this binding compels the liver to extract LDL cholesterol from circulation for bile synthesis, naturally lowering circulating LDL concentrations. Second, Brussels sprouts reduce LDL oxidation, the process transforming cholesterol into plaque-forming particles. Biochemically, Brussels sprouts activate hepatic detoxification pathways through compounds like glucosinolates. These compounds facilitate more efficient hepatic clearance of excess cholesterol and inflammatory byproducts. They additionally support nitric oxide availability, improving vessel flexibility and circulation. Brussels sprouts contain elevated vitamin K1, playing crucial roles in directing calcium away from arteries toward bones, reducing arterial stiffness and lowering calcified plaque risk. An important cardiac patient concern. For optimal cardiac benefits, Brussels sprouts should receive gentle steaming, roasting, or sautéing, not overcooking. Excessive cooking destroys sulfur compounds supporting cholesterol metabolism. 1 cup consumed 4 to 5 times weekly suffices for cardiac health support without digestive overload. 8. Sweet potatoes, potassium-rich blood pressure stabilization. Sweet potatoes rank among the most cardiac-friendly vegetables available, especially for patients managing elevated blood pressure, insulin resistance, or vascular inflammation. They deliver abundant potassium, magnesium, fiber, and antioxidants, proving ideal for cardiovascular stability. Potassium constitutes the standout mineral in sweet potatoes, counterbalancing sodium, relaxing vessel walls, and regulating fluid balance. Adequate potassium intake strongly associates with reduced blood pressure and diminished stroke risk, particularly in cardiac patients sensitive to salt. Sweet potatoes additionally provide slowly digesting carbohydrates, preventing blood sugar spikes. Stable blood sugar proves essential for cardiac health because glucose elevations trigger inflammation and increase triglycerides, both contributing to arterial damage. Sweet potato fiber slows digestion, protects the endothelium, and supports healthy cholesterol concentrations. Within arteries, antioxidants like beta-carotene and anthocyanins, especially in purple varieties, reduce oxidative stress, protecting LDL cholesterol from oxidation and helping preserve smooth blood flow. For cardiac patients, sweet potatoes should be baked, steamed, or boiled, not fried. Portion control matters. 1/2 to 1 medium sweet potato per serving proves ideal. Pairing sweet potatoes with protein or healthy fats further improves blood sugar control and cardiac benefits. 9. Red bell peppers, vitamin C for vascular strength. Red bell peppers rank among nature's richest vitamin C sources, a nutrient essential for blood vessel integrity, cholesterol protection, and overall cardiac resilience. Unlike citrus fruits, red bell peppers deliver elevated vitamin C with minimal sugar impact, proving especially suitable for cardiac patients. Vitamin C plays direct roles in collagen production, strengthening arterial walls and preventing micro damage, permitting cholesterol penetration and plaque formation. Stronger vessel walls mean reduced atherosclerosis risk and improved circulation. Red bell peppers additionally contain carotenoids and flavonoids, reducing inflammation and neutralizing free radicals. This antioxidant activity protects LDL cholesterol from oxidation, among the most dangerous steps in plaque formation. Another advantage involves their low sodium and high water content, supporting healthy blood pressure and hydration. They additionally contribute modest potassium amounts, supporting vascular relaxation. Red bell peppers prove best consumed raw, lightly sautéed, or roasted, as excessive heat degrades vitamin C. including 1-2 to 1 cup daily, can significantly improve antioxidant intake and vessel protection for cardiac patients. 10. Kale. Comprehensive arterial protection and cholesterol management. Kale represents among the most nutrient-dense leafy greens for cardiac patients, offering powerful combinations of fiber, antioxidants, nitrates, and minerals supporting nearly every cardiovascular health aspect. Kale reduces cholesterol through soluble fiber, decreasing intestinal LDL absorption. It additionally contains bile acid-binding compounds, enhancing cholesterol excretion. Regular kale intake demonstrates improved lipid profiles without medication escalation. Within circulation, kale provides dietary nitrates converting to nitric oxide. Nitric oxide relaxes vessels, improves circulation, and lowers blood pressure, especially beneficial for cardiac patients with endothelial dysfunction or arterial stiffness. Kale contains abundant lutein and zeaxanthin, antioxidants reducing arterial inflammation and protecting against oxidative stress. Its vitamin K content supports proper calcium placement, preventing arterial calcification. To maximize benefits, kale should be massaged raw, lightly steamed, or blended. Cooking reduces bitterness and improves mineral absorption. A practical target involves 1-2 cups consumed 4 to 6 days weekly, rotated with other leafy greens. Strategic daily vegetable integration for cardiac patients. Building cardiac health transcends consuming one exceptional vegetable occasionally. Genuine heart protection derives from strategic vegetable distribution throughout the entire day, supporting blood pressure, cholesterol balance, circulation, and inflammation from morning through night. Morning, vascular activation and gentle detoxification. Begin with vegetables activating circulation and supporting nitric oxide without stressing digestion. Start with warm water, optionally with lemon supporting hydration and blood viscosity. Include light vegetable-based breakfast, sautéed spinach or kale with olive oil. Small garlic portions gently cooked into vegetables. Optional tomatoes or red bell peppers for vitamin C. These vegetables activate the endothelial lining, support nitric oxide production, and reduce morning blood pressure elevations. Gentle morning vegetable cooking facilitates digestion while delivering minerals and antioxidants. Midday, cholesterol control and anti-inflammatory protection. Midday represents the most critical window for cholesterol management and inflammation control. Build lunch around half plate, vegetables combining Brussels sprouts or broccoli, fiber plus sulfur compounds, carrots or sweet potatoes, beta-carotene plus potassium. Add olive oil for fat-soluble nutrient absorption. Include herbs like turmeric or ginger if tolerated. Cruciferous vegetables at midday support hepatic detoxification pathways, clearing excess cholesterol. Fiber-rich vegetables bind bile acids, reducing cholesterol reabsorption, especially important for cardiac patients managing LDL concentrations. Afternoon, blood sugar stability and vascular calm. Afternoon represents when blood sugar fluctuates and vascular stress often rises. Vegetables function as stabilizers. Roasted sweet potato cubes, small portion, raw or lightly cooked red bell peppers, steamed carrots. These vegetables provide potassium, magnesium, and slowly digesting carbohydrates, preventing stress-related blood pressure elevations. Maintaining low sodium and elevated potassium during this window helps maintain arterial relaxation. Hydration proves key. High water content vegetables additionally support blood flow and reduce blood viscosity. Evening, repair, relaxation, and blood pressure control. Dinner should emphasize vascular relaxation, inflammation reduction, and overnight repair. Build plates with half-plate vegetables, prioritizing kale or leafy greens, Brussels sprouts or other cruciferous vegetables. Gentle cooking methods: steaming, roasting, or sautéing in olive oil. Use garlic and herbs instead of salt. Evening vegetables rich in magnesium, potassium, and antioxidants reduce nighttime blood pressure and calm the nervous system. Avoid heavy starches late at night. Vegetables provide nutrients without stressing insulin or digestion. Nighttime, mineral balance, and overnight cardiac recovery. Vegetables consumed earlier continue functioning overnight, though nighttime habits matter. Support recovery by avoiding late heavy meals, maintaining earlier evening hydration, supporting sleep, essential for endothelial repair. Magnesium-rich vegetables consumed during daytime reduce nighttime arterial stiffness and improve sleep heart rate variability. Research consistently demonstrates that vegetable timing matters as much as vegetable selection. Studies demonstrate that diets elevated in vegetables distributed evenly throughout the day lower LDL cholesterol, reduce blood pressure, improve endothelial function, and reduce cardiovascular events in cardiac patients. Benefits derive from consistency, variety, and daily exposure. not occasional large servings. Building cardiac health through strategic vegetable consumption. Cardiovascular wellness develops incrementally, and vegetables represent among the most powerful tools available for protecting your heart, arteries, and circulation. The vegetables examined in this guide function through multiple validated pathways, lowering inflammation, supporting healthy blood pressure, improving cholesterol balance, enhancing nitric oxide production, and protecting delicate vessel lining. Collectively, they facilitate more efficient cardiac pumping while reducing sustained cardiovascular system strain. The essential principle involves consistency rather than perfection. You don't require every vegetable daily, but regularly rotating these cardiac protective selections onto your plate generates meaningful improvements over time. Small habits, adding leafy greens to meals, selecting potassium-rich vegetables, or employing cardiac-friendly cooking methods, quietly compound into stronger cardiac function and healthier arteries. This content serves educational purposes exclusively and does not replace professional medical consultation. Thank you for watching till the end of this video. If you found it useful, then please give it a like and subscribe to the channel. And I'll see you in the next video.